So we have a viewer who's writing in for her father. He has a PSA of 0.9 6 months after radiotherapy, and she's wondering how often do they need to do the PSA in order to check for the first year and for the next 5 years.
So our usual policy, I think fairly standard throughout the industry, is to check the PSA every 3 months for the first 2 years after treatment. And this is for people that have had surgery or radiation. To check the PSA then every 6 months for the subsequent 3 years. That takes you out to 5 years. So 2 years every 3 months, 3 additional years every 6 months, and then annually thereafter.
In this situation, what should the PSA be if it's just directly after radiotherapy, and how long would it take to get to that level?
This is something that we see a lot, and that is people are concerned that their PSAs aren't dropping quickly enough after radiation. It can take anywhere from 18 to 24 months for the PSA to drop all the way down to its low point. We call the PSA nadir. If the PSA is continuing to decline in a sequential fashion, we don't get concerned about how quickly it's dropping, because the PSA sometimes will drop very slowly. But as long as it's continuing to decline in a sequential fashion, that's great. After a year or two, sometimes even a little longer, the PSA will settle in probably around 0.2 to 0.5, depending on whether they've had seed implant radiation or SBRT. The nadirs can be a little bit lower with the seed implant because the radiation dose is more intensive. In the old days, we used to say if the PSA was under 1, we would be certainly happy and we would simply watch the status of the patient. But these days now with PSMA PET scans, if someone's 2 or 3 years out, and let's say the PSA nadir down to 0.2, but now it's gone up to 0.5 or 0.7, we might consider getting a PSMA PET scan to make sure that there's no cancer acting up. We didn't used to have that luxury. We would have to basically watch a lot longer, but now with this new technology, it's going to be easy to get accurate information about whether there's any cancer present. One caveat, though, is probably to think about waiting a couple of years, because we know it takes a couple of years for the radiation to eradicate the cancer completely. This has been shown with men that had biopsies. 1 year after radiation, biopsies were still positive, and initially there were fears that maybe the radiation didn't cure the cancer, but then if these men were watched and rebiopsied after 2 years, then the cancer was absent. So it takes a while for the radiation to completely eradicate the cancer in the prostate, even up to 2 years after therapy.
Hey everyone, it's me, Alex, and our mascot Hunter. You can check out his Instagram, Sir Hunter the Dow, at the link below. Don't forget to subscribe to our YouTube channel, and in fact, if this dog high-fives me, high five! Can you high-five me? Thank you. You have to subscribe. Go subscribe to the YouTube channel. He even thinks that's awesome. Also, don't forget to visit our website, PCRI.org.